Alright, let's break down where you can hear each heart sound best. First up, the classic S1 and S2. S1, the lub, is loudest at the apex of the heart, so that's your fifth intercostal space, mid-clavicular line, right where the mitral valve hangs out. S2, the dub, is loudest at the base, so head up to the second intercostal space at the right sternal border for the aortic valve, or left sternal border for the pulmonic valve. But what about those extra sounds? S3, that low-pitched ventricular gallop, is best heard with the bell of your stethoscope at the apex, just like S1. It's easier to catch with the patient lying on their left side, and it often hints at increased volume in the ventricle. Think heart failure. S4, the atrial kick, is also low-pitched and shows up right before S1. Again, aim for the apex, with the patient in the left lateral position. S4 is a sign the ventricle's a little stiff. Hypertensive heart disease is a classic cause. Now murmurs. The aortic and pulmonic murmurs are loudest at the base. For aortic stenosis, plant your stethoscope at the right second intercostal space. For pulmonic murmurs, head to the left second space. Mitral murmurs, like mitral regurgitation, boom at the apex. Tricuspid murmurs, slide your stethoscope down to the left lower sternal border. So, quick recap: S1, S3, and S4, think apex. S2, aortic and pulmonic valves, think base. Murmurs, match the valve to its spot. Practice makes perfect, so grab your stethoscope and start listening. Trust me, the more you hear, the more you'll learn.